Hi, good evening, everyone. I am Dr. Anmol Ahuja, and I bring greetings from Sir Gangaram Hospital. I thank AWR surgeons community for giving me this opportunity to present on for this Tips and Tricks Tuesday. So I'm going to give a short presentation on a hybrid procedure, a laparoscopic patch mesh repair, which we use for a smaller umbilical hernias and for smaller ventral hernias. So this repair we have reserved for hernias which are less than 2 centimeter in size. Usually the we want to do like the guidelines suggest that to place a mesh for anything above 1 centimeter. So this procedure comes in handy for such kind of hernias. So what we do here is this is the port position. So make up entry from Palmer's point. Place a 5 mm port here. Visualize the cavity. Place one more 5 mm port around 8 centimeters apart. And then from this port, we will do the dissection of the contents as well as if falciform ligament or the umbilical ligament are coming up to the umbilicus, those can be dissected off. If we require traction from our left hand, then we can place one more port here. So now once we have placed the port, we do a diagnostic lab. So this is how the hernia will appear. A piece of omentum or bowel will be going into the umbilical hernia, and this will be removed. So I'm using a hook to remove the contents. So the dissection is easy because pneumoperitoneum is there. You are able to clean it off easily. Then make a small subumbilical incision of around 1 to 1.5 centimeters. Do the dissection, use the cat's paw retractors well. We identify the edge of the defect and hold both the edges in the Alice forceps and dissect the complete sac 360-degree all around it. And then we remove the sac so that there is no post-operative swelling or seroma present at the hernial site. So now you see here we are removing the complete sac. We have held both the edges of our defect with the Alice forceps. Now clear this area up. This is the inside view. So we have kept our scope inside the abdomen and we are able to look inside the abdomen of what is happening at what time. So you keep both the edges of the margins pulled out so that your pneumo does not collapse. So this is the mesh which we use. This is a patch mesh by Bard. It's a 8 centimeter mesh. It has two proline phalanges. It's a dual layer mesh. So this is the mesh which is used for this particular procedure. You make uh, the visceral surface wet and insert the mesh in one go and pull both the phalanges up. So this is how the mesh gets placed inside the abdomen, and once you have pulled both the phalanges up, you close the defect. Pull both the Alice on the opposite side so the defect gets closed and your pneumo gets formed well. So now we are able to, you can see, appreciate the good pneumo has been created, pneumoperitoneum, and the mesh is lying straight. If you see here, we have removed the falciform. So why this falciform has been removed, because otherwise the falciform will come in between the mesh um, and the abdominal wall, posterior sheath. So this is the advantage of laparoscopy, that you are able to identify this when it is happening. Now we are putting and fixing the mesh with tackers. Usually 5 to 7 tackers are more than enough, or maybe 6 tackers. You place, now you can see the mesh is placed very perfectly. It is sitting very flat on the inside the abdomen. And now we will again go to the skin side. So what you do is we will fix the two phalanges of the mesh to the sheath. You can see past the proline 1O suture, and we fixed one edge on the one side and the other edge on the other side. After you fix both the phalanges, you cut these phalanges and then close the defect with multiple interrupted proline stitches. So this is how you do a complete repair, the reconstruction of the defect, as well as reinforcing it with a mesh. So this is how we do it. After closing the defect, you put some subcutaneous stitches here on the fat and then do a skin closure with subcutaneous stitches. So usually you land up with an incision of 1 to 1.5 centimeters and two incisions of 5 mm. So This is how this procedure is completed. We have been doing this for quite some time, and it has given us very good results in terms of patient comfort, pain, post-operative pain, as well as cosmetic outcomes. So we are happy doing this procedure. Also, the mesh is comparatively cheaper as we compare to the other dual layer meshes. So I hope you like the video. I'll be eager to know your comments and thoughts about this particular procedure and what is your experience. Thank you so much to everyone.